I want to ask you about concerns we've heard from a lot of public health officials about the CDC's response, or as they say it, lack thereof. They say that the CDC should have deployed a team to help investigate the outbreak. They say the CDC should have deployed a team to collect samples, to help with contact tracing. They say the CDC should have been communicating sooner through press briefings and press guidance and news briefings, and that its health alert network should have been more active and been more clear about how the CDC is involved, especially since we're no longer part of the World Health Organization. They say that had this been a virus that spreads more easily than the hantavirus, we would be in real trouble right now. How do you respond to all these critics?
Well, I think it's they didn't see what the CDC has been doing, right? So we are in touch with the WHO. We're in touch with the international health organizations, including the one in Spain, and we have been providing technical assistance to all of those organizations all the way through. This is not COVID, Jake, and we don't want to treat it like COVID. We don't want to cause a public panic over this. We want to treat it with the hantavirus protocols that we're successful in containing outbreaks in the past. And so we followed those protocols. Like we gave this health alert is coming out because, again, there's this discrete event of the 17 arriving in the United States very, very soon. And so we just want to make sure that the medical community understands this. We've been communicating the last week as the press attention has picked up more with the public as is appropriate given the nature of this disease. The key message I want to send to your audience is that this is not COVID. This is not going to lead to the kind of outbreak. And I was pleased to hear your the opening segment where you emphasize that, because we shouldn't be panicking when the evidence doesn't warrant it.
Absolutely, and we've been covering it that way the whole time. There's no evidence that this is anything close to the COVID pandemic, and it's very difficult to get the hantavirus. Person-to-person contact is very difficult to happen, but there are concerns, and what I'm hearing from health officials, public health officials, is less about what is going on with hantavirus and more about how this might bode for a more serious outbreak. And on Thursday, President Trump said that the outbreak is quote, very much, we hope, under control. But here are some of the issues. 2,400 people have been laid off from the CDC last year. The CDC does not have a confirmed director. You're acting director. There's no Surgeon General. There's no top vaccine regulator at the FDA. Certainly you can understand why the American people might find that worrisome.
Well, all I can tell you is, I've been at the CDC now for about 2.5 months. I've been so impressed, Jake, by the professionalism of the people that are there, and especially the disease outbreak people are true professionals. And so to the American people, I say that the CDC has absolutely been working, night and day to stay on top of this, to keep you safe from outbreaks like this. You want to moderate the response to the actual epidemiological threat, and so that's what we did with this hantavirus threat, as you said, Jake. If the threat level were higher, then we would have obviously reacted differently. There's no, in my view, at my professional judgment as acting CDC director, been an absolutely professional response to this by the CDC. There's as you know, Jake, the president has nominated a new CDC director. Hopefully, the Senate will vote in coming months, that hopefully that I'll make sure that transition is as smooth as I can possibly make it. I've been going regularly down to the CDC. It's hard to wear two hats: the NIH hat as director and also the CDC hat. But I've been going. Basically, I haven't gotten a lot of sleep the last 2.5 months to stay on top of this. These are enormously important organizations to the health of the country, and I can assure you that the CDC has been absolutely on top of this outbreak.